Okay, now we're going to do collecting a sputum specimen. And so the first thing I need to do is need to check the doctor's orders for the type of sputum specimen that will be ordered, and also to look for isolation precautions. Because sometimes if a patient is potentially thought to have TB, then what we have to do is we have to require 3 consecutive morning samples. So what we're going to do is we're going to collect, we're going to check on that, the number of samples we want to do, and the type of specimen collection. And so we're just doing a regular sputum specimen today. So I got my equipment here. I have a specimen cup that has a label on it. We have some water for the patient to gargle with. We have a biohazard bag to send it to the lab. And we have an emesis basin and a pair of gloves if we need to intervene. And also we have a check to be able to protect the patient's clothing in front. Okay, so we're getting ready to do, I'm going to open the door. Nursing! Make sure I wash my hands. Rub them till they're dry. Hi, good afternoon. My name is Mrs. Kyle and I'm going to be your nurse today. Can you please give me your name and date of birth? Okay. Justin Pierce, okay, and date of birth 10/3/1960. And we're allergic to penicillin, okay? So Mr. Pierce, what we're going to do today, we're going to collect a sputum specimen. You found that your lungs, you're doing a lot of coughing, and your lung sounds reveal that you have some stuff going on in your lungs, so we want to make sure we don't have a bacterial infection. So I'm going to make... So we're going to make sure that we check that, and I'm going to put your bed up a little bit to working height. And I will don gloves if need be. If the patient's able to do this himself, then chances are they can open the container and then they can expectorate into it. Then we don't need to put gloves on, but if you have to do it for the patient like I will be doing, we'll have to put a set of gloves on. Okay, Mr. Pierce, do you understand the procedure goes? This promotes cooperation and decreased anxiety for the patient. So Mr. Pierce, what you're going to do is I'm going to teach you about taking deep breaths, and then you're going to take a deep breath from your abdomen, and you're going to do a hard belly cough, and you'll be able to cough up sputum for this specimen. Okay? We're also going to assess the respiratory status. We're going to look at the breath sounds, and we're going to assess the respiratory rate, depth, and pattern as we learned in health assessment. And also we're going to look at the skin and the nail bed colors too as well. If the patient is in respiratory distress, you don't want to collect the sputum specimen at this time. And I want to also assess if they have the ability to deep breathe and cough and expectorate, because we might need to have to suction the patient for a specimen. And also we want to know when the patient had a last time they had anything to eat or had a tube feeding, because you have to wait 1 to 2 hours because it can cause the patient maybe to have a risk for aspiration. Okay, so first thing we're going to do is we're going to put the patient in high Fowler's position in the bed. This allows it for the diaphragm to drop and the lungs to be able to span when he's taking a deep breath. We can also have them sit at the edge of the bed if they like. Now we're going to make sure we put on a drape to protect their gown from getting soiled. So I'm putting a chuck across the patient. And the other thing we're going to have the patient do is we're going to, Mr. Pierce, I have some water here. So if you can rinse your mouth and gargle, this helps to keep the bacteria, to clear the mouth and removes flora that may contaminate the specimen as well. We also, in case he has some kind of problem with his chest, like an incision, we're going to give him a pillow to splint his abdomen, because when we splint the abdomen, it puts counter tension on that to help prevent the patient from having problems. Not pillow. So we're going to put the pillow across the abdomen. That way we can splint his incision. Now, Mr. Pierce, what I want you to do, and when you go to cough up the specimen, if you can hold the container and cough it up, What I'm going to have you do is not touch the inside of the lid or anything, because this will contaminate the specimen. So if he can do it himself, you can give it to him that, and make sure you don't put the lid down, face down like this, because this can cause contamination. You want to put the lid up. So the other thing is, because my patient can't really do this himself, I'm going to put on gloves to protect my hands from getting any kind of bacteria on them. So Mr. Pierce, what I want you to do is make sure you take a deep breath. So he's going to take a deep breath in through his nose and out through his mouth, okay? I want you to do that 2 times. On the 3rd time, what I want you to do, Mr. Pierce, he's going to take a deep breath in through his nose, he's going to hold it, and then all of a sudden make a big belly cough. And then as he does that, I'm going to hold the specimen container up here so he can cough into it, get secretions, because we want, instead of saliva in the mouth, we want it to come out into the specimen. We actually want a sample from his sputum from his lungs to come up from there. Now, deep breathing helps open the airways and also stimulates the cough reflex. So coughing after full inhalation creates enough force to mobilize secretions through the airways to the pharynx. Okay, Mr. Pierce, what we're going to do is we're going to have you cough up into the cup, because when you cough into the cuff, what's happening is we're going to do a deep belly cough, because that way we want to get actual sputum instead of saliva into the cup. So then what we're going to do, but since he's unable to cough up by himself, I'm going to tell him how to do it. I'm going to put gloves on, and I'm going to actually have him, if he was to do it himself, I want to make sure he does not put his fingers in the cup, because it can cause bacteria to contaminate the specimen. So Mr. Pierce, what I want you to do now is I want you to take a deep breath in through your mouth, in through your nose, and then out through your mouth. I want you to do that 2 times, okay? When you take a deep breath in through your nose and out through your mouth, deep breathing helps open the airways, and it also stimulates cough reflex. So after full inhalation the 3rd time, I want you to take a deep breath, and then I want you to take a deep belly cough, okay? And he did so, and so I'm getting sputum versus saliva. I'm getting sputum up from his lungs, so we can see if there's any bacterial infection. Because coughing, what it does is it mobilizes secretions through the airways into the pharynx. Okay, Mr. Pierce, I want you to do that until we got at least 5 to 10 milliliters in here, so we're going to put the top on. And we're covering the specimen taper again, not touching the lid. And our gloves on protect from contaminating the outside and preventing the spread of microorganisms. Now, I'm also going to label the container with the patient's name. And this is a sputum specimen, as the patient has possible pneumonia. This way we get adequate diagnosis treatment, and we're going to put the specimen into what's called, this is a biohazard bag, and in the biohazard bag, what's happening, we're going to put this and send this to the lab within 30 minutes, because a warm, moist environment breeds bacteria, so this has to go into the lab within 30 minutes. And also the biohazard bag prevents any healthcare workers from picking up any microorganisms. So if you don't, like I said, if you don't send it to lab in 30 minutes, you can have some problems with the cultures becoming contaminated and organisms start growing, and you can have a false positive response. Okay, we already taught our patient for proper collection techniques to avoid contamination, and he did proper coughing, so to ensure adequate specimen collection. Instead of, like I said, getting saliva from the mouth, we actually got, and we have to be able to ensure that we get a good deep cough with good specimen from his lungs. And Mr. Pierce, we didn't use mouthwash. We had you gargle today, because if you use mouthwash, it can alter the results of your test too. So we never used mouthwash before. And we taught him how to splint to avoid discomfort during his coughing and expiration, especially because he had a surgical one. Okay, when you're done, anytime you're doing any kind of respiratory procedure, you always beforehand, like we assess the lungs beforehand, you always assess the lungs, look at capillary refill, skin color, nail bed color. You always want to do that at the end when we're done, to make sure your treatment was effective. So any type of oxygenation intervention always requires respiratory assessment before and after. And we're also going to evaluate the color, consistency, or odor of the sputum. If the patient were to have clear sputum, it could be they have a cold. If it's yellow-green, they can have a bacterial infection. And we're going to report the results of the sputum specimen to the doctor immediately. And we want to make sure he understands his test results and he tolerated procedure. He doesn't seem to be short of breath after the procedure. Now, Mr. Pierce, I'm going to put you back down. I'll take off these gloves so we don't contaminate touching the bed. So we're going to put this down, bed down, back to low position so the patient won't fall out and won't hurt himself. Mr. Pierce, would you like your head of bed down slightly? I know 90 degrees is kind of high, so we want to put it down to where it's comfortable for him. And we're going to make sure the top 2 rails up and his body's in alignment. And Mr. Pierce, are you having any pain or discomfort at this time? No? You're fine? Okay. So we're going to place call light and reach. Now, Mr. Pierce, if there's anything you need, just give me a call, push the button. Okay. And we're going to put the table down to his level, and we're going to make sure we put everything by the tray table next to him because we want to make sure he doesn't fall out of bed trying to reach anything. And we're going to wash the hands, and I'm going to report any abnormals to the nurse. Now, of course, I'm going to get this, like I said, 30 minutes down to the lab. The other thing is I'm going to document. I'm going to make sure I document and put down in here the chart when I collected the specimen, and it was collected by deep breathing, coughing. So I collected the specimen, and it was clear, thin sputum, okay, and I didn't see no odor that I could smell, and he had no pain, no anxiety, or shortness of air. So I documented all that stuff, and I'm ready to go on to the next procedure.